Welcome back to the deep dive. We're here to cut through the noise and get you informed fast. Okay, imagine this. 2 billion people around the globe facing really crippling financial hardship just because they need healthcare.
That's an almost unbelievable number.
It really is, and a massive part of that burden, it's just trying to get their hands on essential health products, like life-saving medicines.
It's a staggering figure, and it really underlines why what we're diving into today is, well, absolutely critical. It's not just a statistic, it's a profound global inequity. It affects lives, livelihoods, every single day.
Absolutely. So our mission in this deep dive is to unpack a really crucial new document from the World Health Organization.
That's the WHO.
Exactly. It's their roadmap for WHO Action 2025-2030, and it's all about access to safe, effective, and quality-assured health products and technologies.
Think of it as maybe a global game plan for a healthier, more equitable world.
Yeah, a game plan. That's a good way to put it. We're going to explore what this roadmap really means, why it's so vital right now.
And the concrete actions WHO plans to take. The goal is ensuring that everyone, everywhere, actually has access to the health products they need.
So let's unpack this. The core problem seems pretty clear. From, the simplest bandage to the most advanced vaccine, these health products are just indispensable.
Completely. We need them for everything. Prevention, diagnosis, treatment.
And ultimately achieving that big goal of universal health coverage, or UHC.
Right. But as that opening statistic showed, they're often unavailable or just way too expensive.
Particularly in low and middle income countries, right?
That's where the gap is often widest. And what's truly fascinating, or perhaps alarming, is the sheer scale of these disparities. And the hidden dangers, too.
Hidden dangers.
Yes. Beyond the 2 billion facing financial hardship, there's this estimate. A global spend of around $30.5 billion on substandard and falsified medical products.
Wow. $30.5 billion low and middle income countries.
Exactly. Think about that. It's not just money wasted. It's dangerous, ineffective products getting into health systems. It undermines trust, puts lives directly at risk.
That's profound. And it hits specific communities harder, doesn't it?
It does. It's truly alarming when you hear that in some countries, as little as, well, maybe 0% to 41% of health facilities actually have essential medicines available and affordable.
0%. That means the very basic tools for care just aren't there for people who need them most.
Precisely. And this disproportionately affects vulnerable groups, people in poverty, conflict zones, older persons, individuals with disabilities, women and children too.
So why is this problem so persistent, especially now in our sort of modern world?
Well, it's a confluence of factors. We're living in a rapidly changing world, right? Demographics are shifting. Think about the aging global population needing more specific products.
Right, different needs.
And disease patterns are evolving. We're seeing rises in non-communicable diseases like heart disease and diabetes and mental health issues. Plus, environmental factors are playing a bigger role.
Like climate change.
Exactly. Climate change is altering patterns of vector-borne diseases, things like malaria or dengue. All these trends, they directly increase the fundamental need for a wider array of health products.
And then, of course, we had COVID-19.
Ah, yes. The pandemic.
It wasn't just a crisis. It felt more like a harsh stress test for the whole system.
It absolutely was.
Yeah.
It laid bare and dramatically worsened those existing inequalities in access to everything.
Yeah.
Masks, tests, vaccines, you name it.
It undeniably highlighted the urgent need for, long-term resilient strategies, not just quick fixes.
Definitely. And we're still grappling with other ongoing challenges too. Antimicrobial resistance, for instance.
Where common infections become untreatable.
Terrifying.
It is. And even things like the environmental impact, the plastic waste generated within health systems. It's a complex picture.
It's a lot to contend with. But you mentioned it's not all great. There are opportunities too. Yes, absolutely. Technological advances offer incredible opportunities. AI, digital health tools, robotics. They could revolutionize how we develop and deliver health products.
Things we couldn't have imagined just a few years ago.
Right. But, and this is a crucial but, we have to acknowledge the inherent risk. These new innovations, they could actually increase inequality.
How so?
Because they often come with higher price tags. So if their rollout isn't managed really thoughtfully to ensure broad access, the gap could widen even further.
Okay, so with these huge challenges, but also these new opportunities, WHO has developed this roadmap for 2025-2030. What's the core idea behind it?
Well, importantly, it doesn't start from scratch. It builds directly on previous work, specifically the roadmap from 2019-2023.
Okay.
And crucially, it integrates all those hard-won lessons from the COVID-19 pandemic. Its main goal is to guide WHO's member states, that's the countries themselves, and other key partners in really increasing access to health products.
Ultimately aiming for those sustainable development goals for universal health coverage.
Exactly, that's the end game.
And WHO seems uniquely positioned for this, right? They have this role that's almost unmatched globally.
It is unique. It's rooted in their constitution. They have global reach, technical authority.
And that ability to bring everyone to the table, experts, stakeholders from all over.
Precisely. That allows them to act as a kind of global orchestrator. They develop evidence-based guidance countries can trust. They help build capacity within countries.
So countries can stand on their own 2 feet eventually.
Right, and they manage these vital global platforms that make collaboration easier. If you look at their role, it's described as end-to-end in the health product ecosystem.
And the end, meaning?
Meaning, from the very beginning, the earliest stages of scientific research and development, all the way through to making sure the products are actually used effectively on the ground, making a real impact.
Like overseeing the entire life cycle of every essential medical tool.
You could say that. It's incredibly comprehensive.
And the scope of products. It's not just prescription drugs.
Right. Oh no, far broader. The roadmap covers a very wide range. Medicines, yes, but also vaccines, all sorts of medical devices.
What kind of devices?
Everything from in vitro diagnostics, like rapid tests for diseases, to assistive products, that wheelchairs, hearing aids, things like that. Also essential blood products, and even vector control products.
Vector control, like for mosquitoes.
Exactly. Products used to fight diseases carried by insects, like malaria nets or sprays for dengue control. So it really is the whole spectrum of what's needed for health.
That is incredibly comprehensive. And you mentioned this roadmap aligns with WHO's bigger picture.
Yes, it's deeply connected to their 14th General Program of Work, GPW14. That's their main strategic plan for global health for the next 5 years or so.
So it's a key piece in that larger puzzle for advancing primary healthcare and building up health systems for UHC.
Precisely. Now, to actually tackle all these challenges we've discussed, the roadmap is structured around 2 main objectives, which are interlinked, and 5 key programmatic areas.
5 areas. Okay, like pillars of action.
Exactly. Think of them as the main pillars guiding their efforts.
That framework makes sense. It sounds like they've really thought through the entire journey, from an idea to actually helping someone.
They've tried to cover all the bases.
Okay, so let's start at the beginning of that journey. Programmatic Area 1, Research, Development, and Production. What's the main issue WHO is trying to solve here?
Well, the core challenge, historically, is that R&D often focuses heavily on health issues in high-income countries.
Driven by profit potential, mostly?
Largely, yes. Driven by potential financial return rather than the most pressing global public health needs. Then there's intellectual property, IP.
Right, patents and things.
Essential for incentivizing innovation, no doubt. But it can also, unfortunately, hinder affordable access if it's not managed carefully.
And manufacturing.
Manufacturing capacity is often concentrated in just a few regions. It's not diverse enough geographically. This became painfully clear during emergencies like COVID-19 with all the supply chain shocks.
Right, suddenly everyone needed things made in the same few places. So WHO's approach here isn't just about making more stuff.
No, it's more fundamental. It's about trying to shift who benefits from R&D and how products get made and distributed. They're prioritizing R&D that's driven by public health needs first.
Okay.
They're supporting more geographically diverse and sustainable manufacturing, helping build capacity in different regions.
Like the World Local Production Forum you mentioned.
Exactly. That's a key initiative. And promoting the use of IP rules in line with global agreements, like the TRIPS agreement.
The trade-related aspects of intellectual property, right?
Yes. Using those rules in a way that maximizes both innovation and access. It's a balancing act.
A tricky balance. Okay, moving to the next pillar, safety, efficacy, and quality assurance. What's the problem here?
The core issue is a widespread lack of resources and capacity in national regulatory authorities.
These are the bodies within each country that check if medicines and devices are safe and work, like the FDA in the US.
Exactly. They're the safety and quality gatekeepers. But the data is stark. As of late 2024, A huge majority, 69% of these authorities globally, just lack the resources or capacity to perform all their functions properly.
69%. That's concerning. That's like having potentially unsafe or ineffective products slipping through the cracks.
It is concerning. It can lead to delays in getting safe products to market, and critically, it increases the risk of substandard or even falsified products reaching patients, compromising safety.
A massive global vulnerability then. So WHO's approach sounds vital. Strengthening these regulatory systems. How?
They use tools like their global benchmarking tool. This helps assess how mature and effective a country's regulatory system actually is. They work with countries to improve.
Okay.
They also promote reliance and convergence among regulatory bodies.
Meaning countries can trust each other's work more, avoid duplicating efforts.
Precisely. If a trusted authority has approved something, maybe another country can rely on that assessment, speeding things up. And then there's WHO's pre-qualification program.
Right. You mentioned this played a big role during COVID. How does it work? Why is it so powerful?
It really is a game changer, especially for resource-limited settings. WHO pre-qualification independently assesses the quality, safety, and efficacy of specific, often essential, health products.
So WHO gives it a stamp of approval.
Essentially, yes. When WHO pre-qualifies a product, it signals to countries, to procurement agencies like UNICEF or the Global Fund, that this product meets rigorous global standards.
Which saves countries time and money on their own reviews.
Exactly. They can purchase with confidence, knowing the product is reliable and safe. It frees up their limited regulatory resources for other tasks. It's hugely efficient.
And I think you mentioned a global monitoring system too.
Yes, the WHO Global System for Monitoring and Surveillance of Substandard and Falsified Medical Products. It acts as a kind of early warning system, sharing alerts about dangerous products found anywhere in the world.
Okay, so that covers safety and quality. Pillar 3 is policy and prioritization. Even if products are safe and effective, cost is still a huge issue, right?
Absolutely. High costs can threaten the financial sustainability of healthcare systems, even in wealthy nations. And many countries, especially those with limited resources, struggle with how to make evidence-based choices about which health products to prioritize and pay for.
So many potential treatments, devices. How do you choose?
It's tough. This is where WHO's guidance is really impactful. They provide crucial advice on evidence-informed selection. This includes helping countries develop and maintain those vital essential medicines lists.
Ah, the essential medicines list. I read it's the 50th anniversary of that concept this year.
It is a truly transformational public health concept that WHO championed half a century ago. The idea that every country needs a core list of affordable, effective medicines to meet its population's basic health needs.
And that list has evolved.
Significantly. WHO's model list is updated regularly, and the concept is expanded to other priority lists for assistive products, medical devices, in vitro diagnostics. It's all about focusing resources where they matter most.
And tackling affordability head-on.
Yes, through things like the WHO Fair Pricing Forum, which brings stakeholders together, governments, industry, patient groups, to try and find common ground on fair prices.
Okay, that makes sense. So products are researched, quality assured, prioritized, but they still need to actually reach people. Pillar 4, procurement and supply chain management, provision, and use.
Right. This is where the rubber meets the road, so to speak.
It highlights how incredibly complex just getting a medicine from a factory to a remote clinic can be. What are some of the hidden challenges there?
Oh, there are many. It's a logistical maze. Challenges include inefficiencies in forecasting, just knowing how much you'll need and when, poor procurement practices sometimes.
Okay.
Then there's the supply chain itself, lack of capacity, outdated infrastructure like poor roads, or inadequate cold storage for vaccines, especially in remote areas.
Things we might take for granted.
Absolutely.
Yeah.
And then inadequate provision. That means things like ensuring proper maintenance for complex medical devices they break down if not maintained, managing blood supplies effectively, or even just low awareness about how to properly use assistive technologies like wheelchairs or hearing aids.
So it's not enough just to deliver the box.
Not at all. The entire ecosystem around the product needs to be robust.
So what's WHO doing about these very practical hurdles, the ones that decide if a product actually helps someone?
They're developing practical tools for more efficient procurement, offering guidance on market-shaping strategies to make sure there's a healthy, competitive supply of essential products.
Okay.
And critically, strengthening countries' own capacities for better supply chain management and ensuring appropriate product use, training staff, improving systems.
So the prioritized products actually get into the hands of people who need them and are used effectively, not just sitting on a shelf or being misused.
Exactly. It's about health outcomes, ultimately.
Right. Finally, Pillar 5, cross-cutting areas. These sound like the foundations, the threads that weave through everything else.
That's a good way to think about it, yes. One crucial aspect here is consistent, globally recognized names.
For medicines and devices.
Yes, the WHO International Non-Proprietary Name System, the INN system for medicines, is vital.
Why is having a standard name so important?
It improves safety enormously by preventing confusion between different brands of the same drug. It boosts affordability by making it easier to identify and use generic versions, and it smooths out international trade because everyone globally is using the same unique identifier for that active substance.
A common language for medicines and for devices.
There's a similar effort underway with the Medical Devices Information System, or MEDIVIS, aiming for better global identification of devices too. Consistency is key.
Makes perfect sense. What else falls under cross-cutting?
WHO's role in developing international norms and standards for quality. These are like the essential blueprints that underpin global regulation and good manufacturing practices.
Setting the benchmarks?
Exactly. They also focus heavily on improving information for decision-making. Many low- and middle-income countries face significant data gaps.
Not knowing what their real needs are or how well things are working.
Right, so WHO supports them in collecting and analyzing data better, so policies can be based on actual evidence.
And one more cross-cutting area you mentioned earlier, environmental sustainability.
Yes, that's increasingly important. The health sector itself actually has a significant environmental footprint. Emissions, waste from packaging, disposal of products.
Something we don't often think about.
But it's substantial.
Oh,
So
really?
WHO is working to promote more environmentally sound ways to deliver, manage, and dispose of health products. Greener procurement, better waste management. It's vital for planetary health, which is linked to human health.
Okay, so we have this incredibly comprehensive roadmap, these 5 pillars, all these ambitious plans, but how do we know it's actually working? Is there evidence of progress already? How are they measuring success?
That's the critical question. Looking back at the previous roadmap period, 2019-2023, well, WHO played a truly critical role during the pandemic.
Enabling access to COVID-19 tools.
Yes, enabling timely access to vaccines, diagnostics, treatments. That was a monumental achievement under immense global pressure, a real-world test of their capabilities.
And were there other tangible results before the pandemic really hit?
Yes, definitely. For example, 58 national regulatory authorities reached what WHO calls maturity level 3 or 4. That means they achieve stable, well-functioning regulatory systems. That's a major step for ensuring product quality and safety in those countries.
58 countries strengthening their gatekeepers, that's significant.
It is, and here's a powerful number. WHO estimates that between 340 and 400 million more patients gained access to essential products, partly because resources were freed up by countries relying on WHO's pre-qualification work.
Wow, hundreds of millions. Because pre-qualification saved countries time and money.
Exactly. Resources they could then use elsewhere. Plus, on a global scale, WHO issued about 12,000 internationally recognized generic names, those INNs we talked about for pharmaceutical substances.
Which helps with safety and affordability worldwide.
Correct. But measuring overall access has historically been tricky. Getting consistent data across countries is a real challenge.
So how is this new roadmap tackling measurement?
It introduces a brand new approach. For the overarching WHO strategy, the GPW14, they've proposed 2 key indicators, specifically designed to measure progress on access to health products without adding new data collection burdens on countries.
That sounds smart. Less burden means more likelihood of getting the data. What are they?
Okay, the first is called the Health Products Access Index. It's reported on a simple scale, 0 to 100.
And how does it work? Does it require new surveys?
No, that's the clever part. It summarizes existing health service coverage data that countries are likely already collecting for other purposes. So no new data collection needed. It gives a kind of snapshot of how well people in a country can actually get a range of essential health products.
Okay, an index based on existing data. What's the second indicator?
The second one tracks improved regulatory systems for targeted health products. It measures the maturity level, or ML, that national regulatory authorities achieve for different types of products, medicines, vaccines, diagnostics.
So it directly measures how capable those safety gatekeepers are becoming.
Precisely. It assesses how robust their systems are.
And Are there specific targets set for these new indicators?
Yes, there are proposed targets for 2028. For the Health Product Access Index, the aim is for a 2-point increase over the current global average, which is around 72 out of 100.
A 2-point jump on a 100-point scale. What does that actually mean in the real world for patients?
Well, a 2-point increase globally might sound small, but it represents a significant improvement. It means, on average, more people across countries getting access to a broader range of essential health products when they need them, likely with less financial hardship. It indicates a tangible improvement in the reach and equity of health services.
And for the regulatory systems?
For the regulatory systems indicator, the target is to increase the percentage of authorities reaching that stable maturity level 3 or 4 from about 63.6% currently to 65.7%. Again, steady progress in ensuring quality and safety globally.
And the key reason for these specific indicators?
The why is really about enabling better, more consistent monitoring of how the roadmap is doing without overwhelming countries with demands for new data. That's often a huge barrier, especially for lower resource settings. Making measurement feasible is key to tracking progress.
It all comes together then. Ultimately, this roadmap is WHO's comprehensive strategic plan. It's about making sure health products are safe, effective, quality assured, affordable, available, accessible, and acceptable for everyone.
It really is a critical framework for moving closer to that goal of universal health coverage, turning the aspiration into concrete, measurable actions.
Absolutely. And this roadmap guides us towards 2030, outlining these ambitious goals. But thinking ahead, the health landscape is constantly changing, isn't it? New technologies, challenges like climate change intensifying.
It never stands still.
So here's something to think about. As these innovations emerge and global challenges keep evolving, what kind of adaptability, in our policies and how we collaborate, even in our own thinking, what kind of adaptability will be most vital? How do we ensure that this vision of universal access to health products doesn't just stop in 2030, but actually extends far beyond, truly reaching every single person everywhere?